Hi, everyone. I'm Ashley Bassett.
And I'm Catherine Logan.
And welcome to Overtime with the Sports Docs. On each of these mini episodes, Catherine and I chat about a new article or new surgical technique in the field of sports medicine. We'll give you our quick take on the most recent data and how this data will impact our practice. So today we're breaking down a new study looking at the HIP Return to Sport After Injury Score, or Hip-RSI, and whether it can help us evaluate psychological readiness to return to sport after surgical repair of a proximal hamstring avulsion. The study is hot off the press. It was published in the November 2025 issue of OJSM, so this month, and it was performed by Hardy and colleagues at the Clinique du Paris, that's fancy, and is titled The Hip-RSI Score for Evaluating Psychological Readiness to Return to Sport After Surgical Repair of a Proximal Hamstring Avulsion. For many of us, being active isn't just about sport. It's about living fully. But when knee pain or ankle instability gets in the way, it can feel like your body is holding you back.
That's where push braces make a difference. The PushMed ankle brace AcquiFlex and the Push Sports knee brace provide the stability you need without locking you down. Sleek, comfortable, and crafted in Europe, they're built to move with you. Whether that means training hard, going for a run, or simply staying strong and confident day to day.
With innovative designs that support while allowing natural movement, push braces help athletes and active people alike find relief, prevent pain, and stick with their treatment so they can keep momentum in their lives.
See the difference at bracelab.com. Clinicians can email samples at bracelab.com and mention the Sports Docs for a free sample.
JRF Ortho has some exciting news. Starting early in 2026, JRF Ortho is launching a quarterly traveling fellowship program designed to provide you with hands-on exposure to osteochondral allografts, meniscus, and ligament repair, all in a dynamic and stimulating hands-on environment.
Each fellowship will be led by distinguished faculty with opportunities to learn in different regions across the U.S. Fellows will also get an exclusive behind-the-scenes look at tissue processing with tours at JRF Ortho's partner facilities in Denver.
Every quarter, 3 outstanding candidates will be selected for this unique experience. The first fellowship takes place in Southern California in early February, featuring Drs. Bugbee, Mandelbaum, Merzian, Dean Wang, and Tim Wang. This will be followed by a second opportunity in April.
In late summer, early fall, JRF Ortho will feature 2 exciting options. One will be dedicated entirely to an all-female cohort, with both faculty and fellows coming together to advance women in orthopedic surgery. The other is open to any established orthopedic surgeon looking to explore their knowledge further in allograft transplantation.
Applications are currently open for each of the different options at jrfortho.org or reach out to marketing@jrfortho.org. Elevate your technique. Expand your network. Lead the future of cartilage restoration by applying today.
All right, so let's get into it. So our listeners may know this score was originally developed for femoral acetabular impingement, or FAI, but the authors of this recent OJSM paper are asking, does it work for a totally different injury, the one that often requires long rehab and has real psychological component?
All right, so a bit of background. The Hip-RSI was created because we know psychological readiness is a huge factor in returning to sport after hip arthroscopy. Fear, confidence, trust in the hip, these really drive return to play outcomes. And with proximal hamstring avulsion injuries, we see the same psychology showing back up. Fear of re-rupture, hesitancy with sprinting or explosive movements, and a long course to get back to high-level sport.
So the purpose of the study was to evaluate 2 big questions. So first, is the Hip-RSI valid and reliable in this population? And next, can it actually predict return to pre-injury sport at 9 months? So this was a level 3 prospective cohort. There was 84 patients and the age range was 21 up to 85.
85? Oh my gosh. Returning to sport. That's admirable, girl.
They all had primary proximal hamstring avulsion repair and completed the Hip-RSI at 4 months and 9 months after surgery.
They compared the Hip-RSI to the Parisian Hamstring Avulsion Score, or PHAS, using the Pearson correlation to test validity. They also test reliability with interclass correlation and looked at internal consistency with the Cronbach alpha. Are you all with me still? It's a lot of stats. But more importantly, they assessed discriminant ability. So that is, can this Hip-RSI distinguish those who return to their pre-injury sport from those who did not return to their pre-injury sport?
And then an interesting question, is there predictive ability at 4 months? So when they're doing all those scores at 4 months, does it tell you what's going to happen at 9 months? All right, so let's look at the results. So we're looking at, how does it correlate with PHAS? So the Hip-RSI had a strong correlation with the PHAS. And so our value was 0.55. So that's meaningful. It suggests psychological readiness aligns with functional recovery in hamstring avulsion patients.
The ICC was 0.89, which demonstrates reliability of these findings. Cronbach alpha was 0.97, suggesting very high internal consistency, maybe even some redundancy among some of the items. With regards to discriminative ability, patients who returned to sport had significantly higher Hip-RSI scores than those who did not, so it was able to differentiate between the groups.
A lot of stats, but we'll summarize it in the end. So as for the predictive ability, the area under the curve was 0.76, which is an acceptable predictive range. So at a cutoff value of 51.7, the Hip-RSI at 4 months had 69% sensitivity and 77% specificity.
So as Catherine just said, it's a lot of stats we're giving you, but they're important because they're meaningful. So what does that mean? So if your patient's Hip-RSI is above 51.7 at 4 months, they are more likely to return to their pre-injury sport by 9 months. So the main finding of the study was that the Hip-RSI score is valid. It's reliable to identify psychological readiness to return to sports in patients who undergo surgical repair for a proximal hamstring avulsion.
And the Hip-RSI score demonstrated moderate, discriminant, and predictive validity with a postoperative 4 month score threshold of 51.7%. And so if you remember, that sensitivity was 69%, the specificity was 75%. And so that's predictive of a return to pre-injury sport at 9 months, which is crazy that at 4 months you can tell.
Yeah, that really is. And their results showed that a threshold of 51.7 for the 4-month Hip-RSI score is a moderately accurate decision-making tool for predicting return to sports at 9 months. And this was regardless of level of play, taking into account psychological factors such as fear and self-esteem. I think that's really interesting that it was regardless of level of play, because you would think it's probably like more difficult psychologically to get back to a higher level of play, but they did not find that. And the good reliability of their study shows that the Hip-RSI is a valid, reliable tool for assessing psychological readiness to return to sport after proximal hamstring injury. So, Catherine, what do you think?
I think it's pretty cool. And, I think if you're taking care of athletes all the time. If you treat people who are going through hamstring avulsions, it's long, and that recovery is not linear at all. They have a lot of ups and downs. They have a lot of atrophy. They even have quad atrophy. Their gait is all disrupted for a while. And then you're starting to work through progressive loading to get them back to things. And it's super slow, and they have setbacks. So I think that psychological side that we're starting to identify, okay, let's look at these markers, is huge.
Yeah, absolutely. And I think in this area, but also kind of all areas of sports medicine, we tend to underestimate that psychological side. But this study really reinforces that psychological readiness, it isn't optional. It's a core component of successful return to play. It's a core component of recovery after surgery and after orthopedic injury. So this tool is pretty easy to use. It's a low burden tool to add at the 4-month visit, and it helps identify patients who might need more mental performance support, especially when physical milestones look good, but the athlete still hesitates with sprinting or change of direction. There are things that we can do to help them get there by 9 months.
So the sensitivity and the specificity are moderate, so they're not perfect. So you're not using 51.7 as pass fail, but you can look at, just like we do with shoulder instability or ACLs, you're going to pair the Hip-RSI with the strength testing, with the functional progression and the rehab, their movement quality, just like we do for all those other things. So Ashley, what are your thoughts? Do you like this?
Yeah, I do. I really do like this. And I think what you just said is really important. It's just one component, right? I think just like I wouldn't prevent someone from going back into play after an ACL reconstruction if all they failed was the ACL RSI. It allows me though to see, where else they may be struggling and also to show them like when they fail that 6-month test and I show them the ACL RSI, I go, look, you're not biomechanically ready, but you're not mentally ready either. And that's concordant and that's good. And we're going to work on getting all of that advanced. So I really like this. It opens up that conversation. What's holding you back? What worries you most about returning? How can we help you? Do we need to get you to a sports psychologist? Like, what can we do? And it lets us intervene earlier without that fear avoidance, lets us work on confidence building rather than waiting until they're like 7 to 8 months out and then saying, oh man, like I wish we had addressed this earlier. Now you're out for even more time than you had planned to be.
Yeah, Ashley, I think well said. I think, the big picture is the Hip-RSI, it's valid and reliable. So for this population, so for our hamstring avulsion population, and it correlates with their function. It distinguishes returners from non-returners, and it has like an acceptable predictive accuracy. So I think definitely something to add into the protocols.
Absolutely. And a score, just to review with everyone, over 51.7 at 4 months suggests an athlete is on track to return by 9 months after a proximal hamstring avulsion repair. But importantly, as we've kind of been hammering home, it reinforces what we talk about a lot on this show. Mental readiness is just as important as physical readiness. We have to be asking our patients about this to make sure they have a successful outcome. Well, thank you for listening to our overtime chat today. We hope you enjoyed our conversation. Make sure to subscribe on Apple Podcasts, Spotify, Amazon Music, or wherever you get your podcasts to stay up to date on all things sports medicine. You should also watch some of our episodes on YouTube. If you like what you hear, please consider subscribing and leaving us a review. You can also reach us by email at thesportstalkspod@gmail.com or find us on Instagram at thesportstalkspod. We love your feedback.